My name's Maggie Burke. I'm the Executive Director of Waterbury Ambulance Service. We are at Waterbury Ambulance Services building where we've been operating out of since 1983. Our crew members range in age from 18 to about 70. Our makeup is just whatever the makeup is of Vermont is or our community is, so we're really grateful to have diversity for Vermont within our crew. We are ready and willing to go on a call whenever it comes in, and every day is totally different, which is one of the things I really appreciate about it. We treat every patient exactly the same regardless of where they're coming from, and some days are no calls, other days are we're going on call after call after call, and it really is different every day, which is awesome. I'd say about 50% of the calls we go on, maybe more, are medical calls, whether it's difficulty breathing, chest pain, an issue with diabetes. We also go on calls that are trauma, whether it's a car accident, someone fell off a ladder. We also go on a bunch of mental health style calls, so someone's having a mental health crisis, we'll respond, or someone who has substance use disorder will respond and help out those folks. So we have a variety every day of what we're gonna see, and it really crosses the gamut. You can never predict which one you're gonna see each day. I like taking care of people, and I really like being there for folks. There's this feeling when you show up on scene and someone goes, they're here. And to be that person, to know that I have the skills to respond in an emergency and do everything I can to help a patient is meaningful to me. I think some of the challenges that we face in EMS come from, number one, a lack of funding that supports us. So I think that the reimbursements that we're getting from the different, Medicaid, Medicare, makes it challenging for us to pay people an amount that's livable or appropriate, especially being a small service, because we don't go on as many calls, therefore we don't bring in as much income from insurance, so we're not able to pay folks in a way that's meaningful. Folks could go work at a bagel shop and make more than they're making to be in charge of an ambulance. I think that there's significant gaps to folks we respond to when it comes to mental health, when it comes to substance use disorder, and when it comes just to access to primary care. Really, folks are not getting what they need for health care right now, and oftentimes the resort that they use is calling 911. We're happy to be there and we're happy to help, but oftentimes the resources that they need are not in the emergency department. They're with a mental health counselor, they're with an addiction counselor, and so helping try and move our industry forward or the healthcare system forward in a way that we can meet people where they are and provide the resources that they need that might not be 911. That being said, again, we're happy to be there. A really great, memorable call we had was at the local golf course. A woman went into cardiac arrest. There's folks, bystanders that showed up and began compressions very quickly. And then we had a crew member respond from home who also got there. We were able to provide the medical interventions that were needed in order for her heartbeat to start again. And we were able to transport her to UVM, where she got excellent care and was able to walk out of the hospital about 2 weeks later. A really great part of that story was about 2 months later, her friends got together who were there with her who didn't know how to do CPR, and they sponsored a CPR class for a group of people to come and learn how to do CPR, and she was there. So we were able to teach CPR to someone who we did CPR on. And that was just a really great moment. The police were there doing CPR, the community was there, and it's a really great feeling when we do something that you can tangibly see a difference. And those moments for us are more meaningful than people know.